Yep. Hola, and welcome to this short presentation of the development of emergency nursing care in Fiji, with a short glimpse of my journey as a nurse in this profession. My name is Praneel Shankar, and I've got somewhat around 12 years of nursing experience within the emergency care. I work as the nurse unit manager of the emergency department at Ba Aspen Hospital. Ba Aspen Hospital is a subdivisional hospital that is located about 35 kilometers away from the main referral center of the Western Division, which is NurseTOK Hospital. I work with 22 nursing staffs in the department with a handful of ward assistants helping out with the basic patient care. So for my presentation, in order for an objective to become successful, we need hope. And with that hope, the common goal was to build emergency care in Fiji and have a structure in place for continuous professional development. On your screen, you might see some pictures, and these are...
Praneel, we can't see your screen. Are you... It's all right. Are you...
I can see it there.
Oh,
Yeah, it's there.
Oh, okay, carry on. I'll work it out this end. It's obviously something to do with my computer. Okay, thanks, Praneel.
Yeah, so on your screen, you might see a few pictures that are on, and these were the influential people within the emergency care family who really made it happen. The very famous Dr. Ann Preeton, Margaret Leong, who was then our director of nursing and who is closely working with the Pacific community at the moment. Dr. Vivek, who is an emergency specialist, who is in Australia at the moment, who actually was one of the driving forces to help emergency nursing come to where it is today. Mamatuki Sosefo, who is the Assistant Director of Nursing at the moment in NurseTOK Hospital. And he is mainly in charge of the critical care. Again, one of the driving forces in getting emergency nursing to its peak. Professor Di Brown, and she is actually the leading hand in getting the emergency nursing specialization framework. And at the moment, she's actually trying very hard to get the emergency nursing specialized. And the famous Bronte Martin, who helped us develop this structure and get this on. So this was the hope, this was the common goal, and this was what this team of influential people thought about of emergency care in Fiji, emergency nursing care in Fiji. Basically, the ingredients of change, there are various factors that come in place when we need a change to happen. First of all, we need to have the passion. We need to have the passion to get things going. Once we have the common goal and a common passion, we get a dedicated team assigned. And the previous slide had actually showed the dedicated team that was set up that would drive this passion and this common goal. Knowing the right people was very, very important, where we can tap on, who we could tap on to get things done. Diplomacy was one of the main ingredients to get things happening. And with that diplomatic approach, we managed to move people and we managed to get the idea across of where we wanted our emergency nursing care to be. And we all know all these things do not happen overnight. We need patience, and we need to have that patience to get things going, get structures involved, and get the paperwork sorted so that there are no stones left unturned. Once we had all that, we started working towards capacity building. What we previously had was we did have bachelor's in nursing, and this was more towards general nursing. So we did not have any formal academic qualification specific towards emergency nursing. We did not have much recognition towards the emergency nursing field. It was more of anyone or anywhere, a person, any nurse from any department could be thrown to the emergency unit and expected to work or perform to their 100% capability. And then again, there was no career pathway for us. If we got the academic qualification, what next? Where would we have gone? That was the picture before. What we have achieved now is there is a 2-year Masters in Emergency Nursing program offered through the Fiji National University, which involves 1 year of postgrad diploma in emergency nursing and 1 year of Masters in Emergency Nursing program. And it does not necessarily have to be completed in 2 years for working students or for students who need to work at their own pace. It could be divided into 4 years where you can achieve your Masters in Emergency Nursing. The employed model that was put up for this Masters in Emergency Nursing program was mostly at your clinical site. So your clinical skills would be at the optimum, and at the same time, your clinical hours would be achieved, and we would have peer reviews and clinical site visit where our mentors and our lecturers and our facilitators would be visibly present on site to coach us and to guide us to help achieve this qualification. It helped quite a significant bit because it avoided disturbance to our skills and practice. And with the expatriate visits, people like Anthony Robinson, who would frequently come into Fiji, get our OSCEs, get our skill tests done. It was quite intimidating, but then again, with the friendly nature of Anthony Robinson, we managed to get things achieved and we managed to get things done. I'm very proud to put up this picture of the very first Masters in Emergency Nursing graduates. These were the graduates of last year, and they achieved their very first Masters in Emergency Nursing in Fiji through the FNU program with the enormous support from the NCCTRC. So this is a lot of people who graduated. And there was a quote by one of the students, the graduates, that completing the program has helped me to be more flexible in adapting to change, to be a better critical thinker, be more assertive, confident, and empathetic in providing emergency nursing care during emergency and disaster situation, and making real changes in the lives of people. And this was quoted by Luisa, who is now the emergency unit manager of the biggest hospital in Fiji, in CWM in Suva. The other graduates have achieved a lot in their life. Few have gone overseas to broaden their education and their qualification, while the other few are in Fiji National University at the post of clinical tutors and lecturers. The emergency nursing program also brought about some change in the medical officers, the doctor's perspective. This was a famous quote and a feedback from one of our, I would say one of our own, Dr. Aloima, originally from Kiribati, but she has become one of our own. And she stated that I'm seeing a strong leadership amongst the emergency department nurses than ever before in the context of patient advocacy, their enthusiasm to learn, their compassion, and their ability to remain professional despite the never-ending chaos around them. You have elevated emergency nursing to a whole new level. And that's one of the achievements we are very proud of. Some of the highlights, like I stated, that I might talk about regarding my career progression throughout my nursing journey. I graduated from Fiji National University in 2012 with diploma in nursing. And then I had keen interest in the military, and I got recruited in 2013. Very fortunate to be deployed through the military to the Golan Heights in Israel, in Syria. That's the border, where I went in as the medical for my company as their medics on site. Throughout the years, I have grasped a lot of education and knowledge on site, and I've managed to become facilitator in emergency life support in the Siren workshop, which is the serious illness in remote environment. We are now facilitating mega code workshops, which is a workshop device for the nursing profession to lead resuscitation codes and perform defibrillation on site. One of the proud facilitators in the MIMS program as well, which is the Medical Incident Management Support, and the South African triage model. I've achieved my bachelor's in nursing in 2016, managed to get my postgraduate certificate in public health in 2018, postgraduate certificate in critical care nursing in 2021, and my postgraduate diploma in emergency nursing in 2022. Some of the highlights of my career progression. And this is what I managed to achieve while I was in CWM Hospital as a registered nurse. One of the quotes that moved me, and this is a famous quote by Mark Zuckerberg, is that the biggest risk is not taking any risk at all. And this is when I decided to take the risk of my life. I decided to move from my comfort zone in Suva, CWM Hospital, where I've stayed for most of my life. And I decided to make a move to Ba. This is when I joined the Aspen Medical Services in 2022 as the team leader. So my career progression with the Aspen Medical in 2022, I joined in as the team leader of the emergency department, where I am currently studying my master's in emergency nursing program with the Fiji National University. The goal for me to come to Aspen Medical in Ba was to upgrade the emergency department in Ba to a whole tertiary level setting. And I have received a lot of support from my medical officers as well. One of my very close friend and our assistant medical director, Dr. Ilikini Naitini, who is holding the post of the assistant medical director, also from the emergency medicine background. And we are working together to build emergency department to a whole tertiary level. The capacity building of our nurses in the emergency department through in-service training, through doing ward rounds, through doing on-site mentorship and teaching them skills while they're on duty, guiding them through their patient care. One of my other focuses was to set up the patient flow through the emergency department. This is a fairly new hospital where there is a lot of room for improvement. There is a lot of areas where patient flow and standard operating procedures needed to be developed. And I'm heavily invested in this to get my emergency department to a whole different level. And of course, this is the emergency department that I work in is the pilot unit for the hospital to achieve accreditation internationally. Furthermore, I was fortunate enough to be promoted as the nurse unit manager in 2023. And now we are working towards the international accreditation, which is the Joint Commission International, hoping to achieve JCI accreditation by 2025. We have successfully performed 2 megacode trainings. And I think 2 weeks back, we managed to have 100% of nursing staff coverage with the South African triage model having covered 100% of all my nurses in emergency department bar and also the emergency department NurseTOK Hospital. I think the executives are quite happy with our performance, and hence I was given the opportunity to mentor the high dependency unit in the hospital. And this is a new unit that we are going to open soon. It is going to be a 4-bed unit where the continuity of patient care is going to happen in Bar Hospital. This is a unit where we are expected to receive patients post-thrombolysis, patient on low-dose inotropic support, patients who require critical care management, but does not need to be transferred to our referral center in NurseTOK. Those are basically some of the highlights of my career progression. It is a very short presentation. I won't take much of your time, but before I end this session, I had a very famous quote that I went through, and it really moves me a lot. This is times when I feel low. These are times when I feel overpowered, when I feel overwhelmed. I always go back to this quote, and it reads, "You're going to feel like quitting. You're going to struggle. You'll have days where you will wonder, what is it all for? You'll have days when people will attempt to break you down or challenge your intelligence, skills, and right to be where you are. You'll have moments when you'll question your own abilities and perhaps your sanity, but you will rise. You will rise every time, not because you're defended yourself, because you understand that this profession, it's not mastered in one day. You will rise because you appreciate each mistake is a learning opportunity. You will rise because even on yours or someone else's very worst day, they still are human underneath it all. And you chose this profession that prioritizes understanding and empathy. You'll rise because the fact that you're struggling and doubting yourself means you're invested in and striving for excellence. You will rise because your strength as a nurse is not determined by one grade, one shift, or one job. It is an ongoing journey of learning, honor, humility, and a chance to make even the smallest difference in the lives of your patients. Thank you very much for your attention. I'll hand over to Beth now, if we have any discussions going on.
Thank you so much, Praneel. And I think I speak on behalf of everyone who just heard that presentation. Very impressive. Job well done. I think you've obviously achieved so much so far, but I think you're going to go on to achieve a lot more over the next number of years. So I think you're an inspiration to a lot of people, including myself. So thank you.
Thank you. Thank you, Beth.
Has anyone got any questions or comments for Praneel that's on the chat? You can either type it in the chat or unmute your microphone. We're all friends.
Hi, Beth. I've got a question for Praneel.
Go on.
So, what advice would you give to someone in a similar situation, maybe someone who's just became director of an emergency department, a nurse? What would be the 3 tips you'd give them?
Thank you, Dr. for that question. So basically, in my experience, I'd say that the learning never stops. And even though if you're a person of status, or if you're a person to achieve something, if you're a nurse unit manager or your team leader or whatever you are, the learning still never stops. And with learning and capacity building, you will be able to achieve great heights. And for me, I personally believe that education really is the key to success. And through education, through formal structured education, we can actually achieve greater heights. So yes, keep on striving, keep on going on and strive for more. And yeah, just the sky's the limit.
Great, thanks, Praneel. I don't know whether you can see all of the wonderful comments in the chat box from pretty much everyone that's been on the chat. Unfortunately, I think Matilda's had to leave us, but she said, amazing job, well done. Dulcie from PNG, thank you for sharing. I feel inspired by your story, well done. I think there's a lot of people have said how inspiring your talk actually has been. So thank you. Erica, have you got something to add?
Well, I mean, apart from that, it was an incredible presentation, Praneel, and so impressive. And I hope this isn't a difficult question, but I obviously come from the rehabilitation side of things, and I've been working with some of your physiotherapy colleagues in Fiji who are doing some really amazing work. I was wondering if you could comment on, do you see multidisciplinary practice in Fiji, and particularly in acute hospitals, growing, or is it something that we need to work a little bit harder on, particularly between rehabilitation professionals like physiotherapists and nursing and medical staff?
Thank you, Erika. So my personal opinion, and please don't quote me on that, my personal opinion is it is really underutilized. And I honestly feel that the physiotherapists, the dietitians, they have a very big impact on patients' health. And the ongoing care and the continuity of care, they really make a difference. And if they're utilized to their maximum, I think we will have very good patient outcome. So if, and thank you for what you do. Thank you for inspiring our physiotherapists or the allied health workers. They are really underutilized. Personally speaking, from Bar Hospital, we have 3 dietitians and we have got 4 physiotherapists, but we rarely see them coming to our emergency department, maybe because the referral and the referral is not very prompt. But yes, definitely, they do make a great difference in patient outcome. Yeah.
Thank you. That's, yeah, something we can always, but in Australia, where it's also something that we're always working on as well. So there's lots happening in Fiji that's really positive. So thanks, Praneel.
Thank you.
Has anyone else got any questions or comments for Praneel or anyone else? Praneel, we have got a very lovely, oh, Veronica, how are you? Oh, Veronica, you're on mute.
I'm good. Thank you, Beth.
Good to see you.
Thank you for giving us this opportunity. And we really appreciate. If possible, can we have a recording of this presentation, Praneel?
Sure, I'll leave it to that, Veronica.
Yeah, Veronica, what we've done is we've recorded this session. So we'll put it on that Facebook page for everyone to watch in their own time. Would that work for you?
That would be great. Thank you so much.
Fantastic, no problem.
Are we seeing you in Melbourne? For NCCN?
Yes, in October.
In October?
Yes. I'll be
Great, thank you so much. I
Because-
think that's the end of my comment. We really appreciate the presentation.
It was great, wasn't it?
Yes,
Cool.
thank you.
All right. I'll be in
We look
touch,
forward to
Veronica.
more of it. Looking forward to more of it.
Yes. Well, next month. Hopefully, we're aiming for the 17th of August for the next one. And hopefully we may have someone from Papua New Guinea talking. So that would be pretty amazing. So
we'll see.
Yes, we'll keep you.
Thank you.
All right. Thanks, Veronica.
Thank you.
All right. And Praneel, I think maybe just one last comment from Leah. She has said, thank you for being a great role model. Your endeavor to empower us at being consistent. With being consistent, we are extremely grateful for. God bless. Wow.
She's one of my staffs, and
so I think that's just another really good example of really effective and fantastic leadership. You know, so yeah, well done. Thank you ever so much. If that's...
Hi, Beth. Can I just say a little comment?
Yes, Matilda, please do.
Thank you very much, Praneel, for your sweet presentation. That was a very great presentation and eye-opening for me, even though I don't work in emergency department, but that was brilliant. Thank you for having that positive mindset to set a great example for your team as a leader. Thank you for being a good role model. And that will be a very great presentation for our people in Samoa to have a listen to and start developing their emergency department nurses. Even with us in ICU, we've just started with the help of Beth giving us the critical care nursing early this year. Was it this year or last year? Which was very great. Thank you, Beth, for that. But the presentation was very good. Like it was brief and very simple. A very good eye-opening for us nurses in the island in Samoa. And that's in the start of your presentation. Thank you very much for giving us hope, for asking other people to help you develop your area, which was very good. It was great of you to ask people to help you, which is another part that we are still developing with one of the senior nurse in Samoa that Beth knows, Natasha. Asking other people, other senior nurses like Bronte and them to assist us in trying and develop different things or different ways to bring up our nurses to a next level, to care for the people that we see every day. Thank you for giving us hope, and thank you for that positive mindset. And yes, I think we can do the same. We can rise as nurses and develop other nurses to take the care up to a quality, safety, to build safety around the patients, especially the people that we look after every single day. Thank you very much. Thank you, Beth, for the opportunity. I just checked my email this morning and I found out that there's a Zoom going on, so I just popped in. I think Tasha is very busy at the moment doing appraisals, but thank you very much for inviting us. So I didn't get the chance to invite our nurses in ICU because I just saw this morning before it started. But as you have mentioned, that there will be a recorded talk that will be very nice for us, and I'll give it to the nurses in our ICU, and probably Tasha will listen to it too. Thank you very much, Praneel. Thank you, Beth. Thank you, everyone, for the invitation this morning, and God bless.
Thank you, Matilda. That was, I think that sort of probably echoed what everyone really wants to say and is certainly thinking. And I think, yeah, probably one of the hardest things that we come across as healthcare professionals is actually asking for help. But knowing there are people out there that want to help, and it doesn't necessarily mean it can, you know, I think ideally this NurseTOK group, that's the idea of this community of practice, in that we all have shared experiences in various aspects of healthcare, and we can actually talk to each other about some of the challenges we have and how we've overcome those challenges. So sort of creating that community amongst us, I think hopefully in the future will serve to be very, very helpful for everyone, especially with people like Praneel being able to join us. So thank you very much. So if there's no other questions or comments, we might let you all go back to work. Because I know Praneel's taken some time out of his very busy shift there to come and join us, as I'm sure a lot of you have taken time out of your work day as well. Sorry, is that someone wanting to say something? No? All right, wonderful. Well, thank you all again for, as I say, finding time to join us. I think it's been a really successful first NurseTOK of 2023. And we'll look forward to the next one in August. And we'll send some details out about that one in the not too distant future. What we might do as one last request, if you've got enough bandwidth, can you put your cameras on for us, and I'll just take a quick photo of us all. I'm proud of myself that I remembered to even do that. We're just waiting for, I totally understand if it's not gonna, if you haven't got enough data. Veronica. Oh,
Hilda.
There's some people.
Elizabeth.
Oh, it's lovely to see your faces. Smile. I'm good. Whoa. Thanks ever so much. All right. Enjoy the rest of your days, and hopefully see you next month. Bye.
Bye. Bye. Bye. Bye. Have a great day.
And you.
Yeah.